day, and welcome to Conversations with AARP and the Virgin Islands. I'm Troy Deshavier Schuster, State Director of AARP in this territory. Thank you for joining us today for another edition of Conversations with AARP. Medicare is a federal social insurance program that was introduced in 1965. It aims to provide health insurance to older and disabled people. Unlike Medicaid, Medicare is not bound to lower incomes or a certain state of poverty. There are, however, a significant number of people who meet the criteria to participate in both programs, Medicare and Medicaid. Medicare is split into parts that support a variety of healthcare needs. In 2021, 76 million people were enrolled in the Medicare program nationwide, which equates to 18.4% of the entire population of the United States. 20,486 of the Medicare beneficiaries are living in the Virgin Islands. While Medicare plays a significant role in the healthcare of Americans, it is a complex program to understand. That is why AARP in the Virgin Islands created this two-part educational and informational series to help Virgin Islanders navigate the maze of Medicare to help support their care journey. This is part two. Joining us today is Shani Amory, Director of the Virgin Islands State Health Insurance Program, also known as VI-SHIP, to discuss the Medicare program and how the recent changes to the program can yield positive influence on the health system of the Virgin Islands. And so we welcome Ms. Shani Amory. Welcome to the show.
Hi, good morning. Thank you for having me again. We're glad to be back.
Yeah, it's glad to have you again. And for our listening and viewing audience, if you didn't see the first part of the series, that was last week. You can find it on AARP Virgin Islands Facebook. You can also find it on AARP Virgin Islands YouTube channel. All of the talk shows are on our YouTube, as well as WTJX Facebook page and WTJX YouTube channel. So please do look at the first part of this two-part series if you haven't done so already. And we hope that this particular part will be equally informative to you for those who are Medicare beneficiaries, for those who are approaching being Medicare beneficiaries, if you're a caregiver. Perhaps your mother, your father, your grandparents, or some person you're caring for is on Medicare or approaching the age for Medicare. So we want to discuss all of the various Medicare parts and the Medicare supplemental insurance plans, and then to get into some more specifics about the Inflation Reduction Act of 2022. So again, as I mentioned at the beginning, Ms. Shani Amory is the director of the VI-SHIP, the Virgin Islands State Health Insurance Program. And so she has lots of important information to share with us. So, Shani, first of all, tell us a little bit about what your office does, just very briefly.
Okay, so the Virgin Islands State Health Insurance Program Office, also known as VI-SHIP, we assist beneficiaries locally here in the Virgin Islands. You can think of us as a liaison between the beneficiaries and the Medicare health program. We empower beneficiaries understanding how their Medicare works, understanding what coverage options are available, what the different parts are. The Medicare Part A, the Part P, the Part B, C, and D, assisting them with any issues with billing or claims. We're the Medicare source here in the Virgin Islands, and our focus is on empowerment and education.
And on St. Croix, are you still located in the Wang F. Louis Hospital? Is that where the office is in St. Croix?
Yes, we are. So in St. Croix, we are the Wang F. Louis Hospital. And then over here on St. Thomas, we are in Niski Center, the lower part where immigration used to be.
Great. And so anybody who needs help, they can just walk in, or do they have to make an appointment first to see somebody in the VI-SHIP office?
So I'm happy to announce, with the pandemic, we had to cut back on our in-person counseling sessions to Medicare beneficiaries. So During the pandemic earlier on, we were doing everything only via telephone, via email, but we were still there, but there were some barriers with that. So we're happy to be able now to serve our beneficiaries in person. So you all can make a phone call to us or you all can just free to walk in. Either way, we're here to assist. So we do accept walk-ins. Yes, we do.
Wonderful. Now, in the last show, we went into great detail about the Part A, Part B, etc. But now, for the sake of this particular program, can you give us just a brief overview of the different parts of Medicare?
Yes, so original Medicare has different parts. Part A is for hospital care. That includes inpatient care in the hospital, nursing home, hospice, and Part B is what we term as medical insurance. That covers doctor visits, services or supplies, preventive services, ambulance care. There's also the Part D, which is for drug prescription coverage. And right now, there is open room that's going on right now. That is running from October 15th until December 7th. So right now is the time for beneficiaries to add on their prescription plan if they don't have it and they want to make that change. Now is the time to add it on. So we said the Part A, the Part B, the Part D, and then there's also Part C, which is known as Medigap or Medicare supplement insurance plans. And we left off on that the last time I was here. We were talking about, the comparison and highlighting the differences between the Medicare supplement plans and the Medicare Advantage plans.
Yes.
So,
So let's go a little more into detail about that because at AARP we get so many questions about these Medicare supplemental plans. As I did last time, I just want to remind the listening and viewing audience that AARP is not an insurance company, right? We do not sell insurance. We do not provide insurance. Um, Unfortunately, we are not equipped to answer all of your Medicare supplemental insurance questions, nor questions about Medicare. So we are bringing you this informative show with the VI SHIP office, which is a local authority that can answer all of your questions and help you to navigate through Medicare and help you navigate through the Medicare supplemental plans. So, having said that, Shani, if you will tell us about the difference between Medicare Advantage and other Medicare supplemental plans.
okay, thank you. So, the Medicare supplement plans are also known as Medigap policies, and they're offered through they're offered through insurance companies that are allowed to sell these plans from Medicare. So Medicare has to allow the insurance plan has to allow an insurance company to sell a to sell a Medicare supplement plan, and it offers additional coverage or simply complements original Medicare, which is Part A or Part B. Okay, so it helps to fill in the gaps, I guess, which is where the term Medigap policy comes from, because it fills in the gap in original Medicare by assisting the beneficiary in additional payments that they may have. So, original Medicare doesn't cover, it covers most, but not all of the costs for healthcare services. Okay. So, that remaining amount that original Medicare isn't covering, that is where the Medigap policy can then fill in to assist the beneficiary in the co-payments, the co-insurance, the deductibles that the beneficiary is typically responsible for, but with the Medigap or medical or Medicare supplement plan, they can assist the beneficiary in covering those costs. So let's say, for example, Medicare covers about typically 80% of a healthcare service, right? So that remaining 20% will be the responsibility of the beneficiary to pay for. However, with the Medicare supplement plan, they will assist the beneficiary in covering that cost.
Right. Now, I have a question that's sort of out of left field, but it certainly relates to this. Um, but it caught me off guard yesterday. Somebody who has a mother in their 80s wanted to get the Medicare supplemental insurance. Uh, this lady in her 80s already had Medicare, but not the supplemental. I directed this person to call the VI SHIP office on behalf of his mother. And when he did, he was told that because she had not enrolled in the supplemental plan, I think at the age of 65, that if she were to enroll in the supplemental plan now in her 80s, that there would be a penalty. Is that so? How does that work with the supplemental plans?
Yes, so typically it is not a requirement, but Medicare does encourage beneficiaries during their initial enrollment to add on their Part A, their Part B, also their Part D, and to consider any Medigap options at that time. This doesn't mean that if they decide not to, that they are not able to at a later time. It just means that the insurance company may impose a late enrollment penalty for the months that the beneficiary went uncovered. So, if the I can actually me and you can connect some more so weeks I can probably get that beneficiary's information to to look into their situation a little because every situation is different. But if we look, for example, at the Part D late enrollment penalty is calculated by looking at the amount of months that were uncovered, and they multiply it by the average, like 3% of the average cost of the monthly premium for the Part D plan. So it can be about like 10 cents for every month that was uncovered. But that's for the Part D. Now for the Medicare supplement plan, if I can assist the beneficiary in determining, whether or not she will have that LEP and also what that LEP may be for her. I can assist her. This is where, the ship counselors come in. We can actually, make those phone calls and we can say, okay, this is what your situation may be. But unfortunately, yes, they are LEPs that are imposed for months uncovered.
Okay, okay. So again, to our listening and viewing audience, when you approach the age of 65, please, please, please visit the VI ship office and get yourself enrolled so that you don't incur penalties for being unenrolled or for late
Uncovered.
enrollment, for having no coverage. So that's really, really important. Don't delay. Please do check into it and get yourself enrolled in Medicare, and then look into the Medigap plans as well. Um, so again, in particular, now for government employees who are retired, who are on Medicare, that's where the Medicare Advantage program comes in. And
Yes.
for those who are not government retirees, then you have other Medicare supplementals. So can you talk a little more about differences between
The
those?
differences. Yes. So, like I said before, the Medicare supplement plans, those are like gap policies to help the beneficiary, by basically, complementing the original Part A and their Part B, and then helping them with their out-of-pocket costs. In comparison, the Medicare Advantage plan is a plan that offers additional perks such as vision care, dental coverage, hearing coverage that are not covered by Medicare nor that are covered by the Medicare supplement plans. Okay, so like you said, the Medicare Advantage was only available current at the time. Let's keep our fingers crossed. Only, for the time right now to people who are VAGA retirees who are 65 years and older and who are enrolled in Medicare. So only that group of people right now are able to enroll into the Medicare Advantage plan. But, like you said, for those who aren't able to enroll into that plan, those who are not government retirees, there are, other covered options available, but unfortunately, those options are not Medicare Advantage plans at the time. Hopefully, we'll
Okay.
see a change in the future. We have to just, keep seeing what's available.
Yes. Yeah. And again, I really encourage people to look into these Medigap plans because, as we know, the copay for major medical care can be extremely high. If
Yes,
there's some catastrophic event in your life that makes a huge impact on your health and your physical well-being, or if there's some chronic illness such as cancer or organ failure, whether it's liver or renal failure, etc. Going through treatment while you may have Medicare, the copay, that 20% that's not covered by Medicare, can be extremely
it
high.
could be
We could
pretty
see,
significant.
yeah, you could see it up into the hundreds of thousands of dollars.
Yes.
So it's worthwhile looking into the Medigap plans when you visit the VI ship office to make sure that you have all the coverage that you need, to make sure you have full coverage, so that
Hmm.
as you're convalescing, as you're recovering from illnesses or injuries, you don't have to have that financial burden on your mind. You know, when we're under stress, it makes recovery so much more difficult, right?
Yes, yes.
And sometimes it really diminishes the outcome of the recovery and the treatment.
Hmm.
So please do look into that. Now, looking here at a new law, AARP successfully lobbied for the passage of the Inflation Reduction Act of 2022, a landmark federal law which aims to curb inflation by reducing the deficit and lowering prescription drug prices. Um, can you tell us more about how this impacts the Medicare beneficiaries and especially those here in the Virgin Islands?
Okay, so the Inflation Reduction Act is going to help to lower the cost for millions of Americans for their prescription drugs. And here in the VI, we're going to see that benefit hitting the beneficiaries here locally as well. Um, when you're reviewing it, it's more so like a timeline of events, like a timeline of different progressions that's going to happen between 2023 and going into 2025. But for 2023, we're going to see that people with Medicare coverage, they're going to see improved benefits in regards to their insulin coverage. And this is a very big deal for those who have, to take this medicine, to control their health. So for Medicare beneficiaries who take insulin covered under traditional Medicare, they will have access to each insulin, and that insulin prescription will cost no more than $35 per month for their month supply. So for their month supply, they will have $35 cap. Like that's going to be no more than they have to pay for their insulin coverage. That's going to begin January 1st, 2023. Okay. And then beginning in July 1st, 2023, you're then going to see that the insulin used through a traditional pump that is covered under traditional Medicare durable Medicare equipment benefit will be covered as well too. So for those who have to take insulin, we're now going to see that in thanks to the Inflation Reduction Act, we're going to see a cap on how much they pay monthly, $35. No more than that is how much they will pay for their month supply for their insulin drugs. And this is a great thing. A lot of times people who do come in and sign up, they need this. So this is something that we have to worry about. $35 per month will be the cap for them. In addition to that, there will also be new vaccines that will be added as well too that will be covered under the Part D coverage, such as Shingrix. So that will be covered as well. So and this will also include other vaccines that are recommended by the ACIP, which is the Advisory Committee on Immunization Practices, and that'll be available at no additional cost as well.
This is all fantastic news. And for our listening and viewing audience, AARP, contrary to popular belief, a lot of people believe that AARP is just for old people and insurance. Again, as I said, we do not sell insurance. We're not an insurance company, and we don't view anybody as being old. Everybody is living their best life, no matter how mature or advanced they may be in their years. But really, at the heart and soul of AARP, we are an advocacy organization. We are a lobbying organization. And several years ago, AARP started a national campaign to lower the cost of prescription drugs. And we rallied all of our 38 million members across the country, including our 22,000 members here in the Virgin Islands. We lobbied all of the members of Congress, both of the House of Representatives and of the Senate, to come up with a plan to lower the cost of prescription drugs. And so this Inflation Reduction Act of 2022 was the first major step in this direction to lower the cost of prescription drugs. And there is still more to come, even beyond this particular Inflation Reduction Act. But as we just heard, this wonderful cap on insulin. We have many, 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 many older people across the country with diabetes living on insulin. especially right here in the Virgin Islands. It's one of the the, the, the most prevalent diseases here in this territory, diabetes. And the cost of insulin can be exorbitant, especially when you're taking it every day. Some people are taking insulin 2 or 3 times a day. So to have this reduction coming up very soon, starting January 1st, is significant. Also, part of this Inflation Reduction Act is the provision of over-the-counter hearing aids, right? Typically, Medicare does not pay for hearing aids. As a matter of fact, they don't pay for hearing aids at all. And hearing loss is a significant problem, right? It's a very important sense. And studies show that when there is hearing loss, there is also the the higher incidence of Alzheimer's and various forms of dementia. And hearing aids are usually, at least good quality hearing aids, are very expensive. On the low end, a really good pair of hearing aids can start off around $3,000. And depending on the type of hearing loss the person is experiencing, they can range in price up to $20,000 for a pair of hearing aids. And even beyond that, if you need cochlear implants and so forth. But but at least now, very soon, pharmacies will be able to provide good quality hearing aids over the counter, so the patient wouldn't have to go through the added cost of going to an audiologist and paying larger sums of money out of pocket for good quality hearing aids. So a lot tied up in this Inflation Reduction Act of 2022. We'll be bringing forth more information on it in future months. And we hope to have our delegate to Congress, Stacey Plaskett, on, our Congresswoman Stacey Plaskett, on one of our shows to talk about it in more detail. So, um, Shani, with this Inflation Reduction Act, what else can we expect to experience here in the Virgin Islands, whether it's Medicare, Medicaid, if you could talk a little bit toward that? Um, what other great and wonderful things does it do for us here in the territory from your perspective?
Yeah, so like we said before, we discussed things. We also discussed, the hearing aids, and I also want to go back and just say in regards to insulin, that $35 cap is not going to have to wait to kick in when the person reaches their deductible. So even though they may not have reached their deductible, they can still take advantage of that $35 cap for their insulin coverage. And like we said, it's going to be a timeline of events, and as we get more information from our CMS, from our ACL counterparts, we'll be happy to share everything as the updates are made available to us. But from what I see, it's going to be up until like 2025. It's going to be a series of different, advances going on, and also, different enhancements in the coverages as well, to available to Medicare beneficiaries. And I'm happy that here in the VI, they're going to be able to take advantage of those those extra benefits. So it's an exciting time, definitely.
Wonderful. This program will be televised and also broadcast on the radio, but right now we are on Facebook Live, and I'm seeing some of the comments coming in from our audience. And so one of our viewers right now on Facebook, when I said that we're not for old people, the viewer said, "We advocate for the young and the young at heart." I
Love it.
like I
Love
like
it.
that. That's perfect. I wouldn't say who it was that made the comment, but for those of you on Facebook, you can see exactly who it was. But that's just a wonderful way of putting it. Advocate for the young and the young at heart, and that's
Heart, I
exactly
love
what we
it.
do. Yeah. And so when it comes to Medicare fraud, now talking about the young at heart, many of our people who may be a little advanced in age but still very young at heart end up becoming victims of Medicare fraud. So, sorry to digress again. The person said I can say, and that's Dr. Kaiser Callwood, a dear friend, personal friend, and a friend of AARP, Dr.
A
Kaiser
friend of
Callwood.
mine too.
Wonderful. Thank you, Dr. Callwood, advocating for the young and the young at heart. Um, so, what does VI Ship Office do to help people avoid becoming victims of Medicare fraud?
Okay, so partners are very are very important. We partner with different agencies such as Senior Medicare Patrol, SMP, and that is to, provide education for educating beneficiaries so they don't become victims of Medicare fraud. The director, her name is Jennifer Logie. Awesome, awesome, and she does these seminars throughout the VI as well. And their focus also is on education and helping beneficiaries to not feel as if their voices don't matter and their concerns don't matter. If there is something, that they need to be questionable, pick up the phone and contact SMP, and they are there to, to guide them and to assist them in overcoming whatever situation may be going on that is questionable. It is disheartening, but like our that population, it is typical very often for them to become victims of fraud, and we have to protect them. And like I said, this is where our partnerships come in with SMP Senior Medicare Patrol. We've been doing a course, some courses of different outreach events going on. So you all can look out for those as well, and we will post them on our LGO page as the events are scheduled to educate our beneficiaries about protection, like we said, from fraud.
That's wonderful. Yeah,
And
legal.
and I'm sorry. I'm
Sure.
sorry. I'm sorry. I was
Go
just
ahead.
gonna say, and one of the basics is that don't ever reveal your Medicare number. If y'all receive phone calls, Medicare will never call you all to say what's your Medicare number to confirm your Medicare number. Don't ever give out your Social Security number. Protect your Medicare card. We have some nice card case that we get the beneficiaries to keep their Medicare card secure and safe, and hold that as if that is your social security number. Don't give it out, don't leave it around laying down, secure it. And they can give us a call for some of those ID packages. We have plenty of them at our ship office on St. Thomas and on St. Croix as well.
I'm so glad you said that about not giving out information over the phone. Yeah, exactly. Social Security, Medicare, Medicaid, CMS, none of those agencies will ever call you on the phone. If anybody calls and asks you for information, hang up.
Hang
Those
up.
agencies will contact you by mail and by mail only. Please do not give out any information. I
No,
always tell my mother the same thing. If anybody calls and asks you for any information, don't give it out over the phone. And they may even ask for your banking account information. They ask for all kinds of information over the phone, right? Don't give it out. Your bank will never call you. Your credit card
no,
company will never call you like that, right?
no.
They're going to contact you by mail. So please be very careful. And we're coming to the end of the show, but I also want to acknowledge the fact that Leonilda Jarvis is watching us, formerly of VHF also, and now one of our wonderful volunteers in AARP. And then again, Dr. Kaiser Caldwell has been with us today. As I mentioned, this is the second part of a two-part series. Please do check out the first part on AARP Virgin Islands Facebook or WTJX Facebook or the YouTube channels of WTJX or AARP Virgin Islands. We're out of time, Shani. Again, thanks for being with us today. And we look forward to having you in a future show.
Thank you for having us. Looking forward to being back again.
Take care.